apparently we had a technical difficulty. If you're on Facebook and you've been watching my mouth move but not say anything, I guess we had an audio problem. So nevertheless, thanks for joining us. This is County Executive Mark Molinaro. We are live on Facebook and on the telephone as well. Let's get again to the data points so that you are aware. As I was saying, for those on the telephone town hall, all of the data points are trending in the right direction. We are certainly have moved into the next phase and hopefully the final phase of responding to this public health crisis. We are now monitoring 627 active cases. That is down from 1,144 cases 2 weeks ago and 2,576 cases at our peak. Today, there are 44 individuals who are hospitalized. We feel for them and certainly hope for their speedy and full recovery. 2 weeks ago, 63 individuals were hospitalized, and at our peak, 172 hospitalizations. Sadly, 441 individuals have lost their lives to this virus, and we obviously are heartbroken for that. We have seen a precipitous decline in the positivity rate. We are now at 2.34%. Now, we've said this many times. The positivity rate is not a perfect measurement. When you look at, however, it averaged over 7 days, it gives us an indication of where we are. That 7-day rolling average at 2.34% is a third of what it was only several weeks ago, and all of that is very, very positive. As we see vaccines continue to roll out, we'll talk a little bit about those vaccine numbers. We are at 46.5% of Dutchess County's entire population having received at least one of those vaccinations. 93,489 have received and completed their entire vaccine series. What that means is that when you eliminate those who are not eligible for the vaccine, children, here's some data points. That means that 56% of Dutchess County's eligible population, correct, has completed has gotten their first dose, and 40% have completed the entire series. So Dutchess County has a total population of 293,718. We'll know if there's more or less in a few months based on the census. We have 245,515 individuals who are eligible to receive the vaccine, and 56.2% of those have begun that process of being vaccinated. While we're on that, Dr. Wythian, I know Wythian's on the call with us. Dr. Wythian is our Commissioner of Health. He is an infectious disease doctor himself. Dr. Wythian, Victor online is asking about any data regarding breakthrough infections, and I assume that term basically meaning those who have been vaccinated. Do we have data? Certainly we know, but do we have data of individuals who have been vaccinated but then still test positive? And while you're answering that question, why don't you explain there is a difference between simply testing positive, meaning you may have it somewhere in your nasal passage, for instance, and actually contracting and/or having symptoms. Dr. Wythian?
Sure, that's a great question. I will tell you that, again, breakthrough infections, we have heard of it anecdotally in Dutchess County. And nationally, what we are finding in terms of data is that while it's reported that Moderna and Pfizer are 95% effective, the number of breakthrough cases are even lower than the supposed 5% that you would expect breakthrough. It's on the order of magnitude around 2%. So breakthrough means symptomatic disease. And what we do find is individuals, for some reason, because of work, because of surveillance testing, because they are part of the university, get regularly tested. If they've had the vaccine, some of them have tested positive. That does not mean that they have symptomatic illness or will end up in the hospital or have an adverse outcome. It just means that there is diagnostic test positive indication that there's virus there. And so on those two fronts, breakthrough infections tends to be actually lower than was expected from national data. we do have cases of breakthrough infections in Dutchess County, but we don't have percentages because we don't know the denominator really well. As opposed to positive testing after vaccination, that also does occur.
Thank you. Dr. V, we're going to go to Stephanie from Poughkeepsie. Stephanie, when we get you in just a second, had a question regarding herd immunity and this term herd immunity. Stephanie, are you there?
Hi, I'm here.
Great. Go ahead, ask your question.
Yeah, I was wondering, has Dutchess County come close to herd immunity yet?
Well, it's a good question, Dr. Wythe, and I'm going to let you answer it. It's, keep in mind the herd is 300 million people across the entire country, not necessarily 300,000 in just Dutchess. Dr. Wythe, could you talk a little bit about herd immunity and what we think the sort of the target is? And I guess I'm going to say this: there's sort of the assumption is right. You get to a certain level of vaccination and a certain level of individuals who might carry antibodies and have grown some degree of immunity, even not being vaccinated. I think I've explained that correctly, Dr. Wythe.
Yes, you have. So herd immunity means having some degree of immune resistance by antibody production through natural infection or vaccination. Now, depending on what public health authority you look at, herd immunity for the U.S., we're looking in the order of between 70 or 80% of the population having some degree of antibody production against the COVID virus. At this rate, herd immunity is quite soft. But I will point out what Mark had already mentioned, which is given the level of vaccination that has occurred within our county, two things should be highlighted. Number one, the population at the greatest risk for hospitalizations or adverse outcomes such as fatalities, the vast majority of them, over 80% of them, have been vaccinated. And what we are seeing is decreased hospitalization and deaths due to that. The second thing that we're seeing is, given the fact that more than 45% of the Dutchess County population have been vaccinated, we are seeing less transmission as a result of that. And part of that is resulting in the lower number of cases per week we're seeing and the positivity rate.
So we obviously recognize that it's a bit of a moving target, but in the populations that are most vulnerable, we've achieved a level of vaccination which is very positive. And then those that might be able to more naturally weather the virus, we're incrementally getting to the point where vaccination and having lived through the virus is getting to us to a point of I won't say herd immunity, getting us to a point of much safer and less risk. So we appreciate that question.
Thank you.
Thank you very much. We're going to try to get to a couple more. Dr. V, Brian is on Facebook. He's asking if there are booster shots. Will you have to take the same specific brand you originally took? I know the answer to that question. Why don't you answer it?
The data is not available at this point, but given what we know about coronavirus, it is not out of the realm of possibility. And in fact, I have a very strong suspicion that booster shots will be needed. I do not believe we have enough data to say that if you receive Pfizer, you must get a Pfizer vaccine, because essentially we see across all vaccine platforms that they are effective. So with that, I'll stop because there's just so much data that is still lacking to make a very specific guidance in terms of whether boosters will be needed, which probably will be the case. But I do not believe that if you received a Pfizer or a Moderna, respectively, that you will be forced to get that same booster.
So, it actually occurred to me as you're saying that, and you've said this before, and the assumption is likely that you wouldn't have to take the same product year in and year out, if you will. Is there what's other than the cocktail, if you will? What's the distinguishable difference between the Moderna and the Pfizer shot? I mean, it's just a different messenger?
It's probably the code in terms of the message, and they probably have their own proprietary ways of arriving at that. But it's interesting in terms of one of the points I like to make is that people may think that, oh, I'll take my chances with natural disease. But we are learning about all the health implications related to natural COVID disease, and it's not something that I would recommend for anybody. And we are also learning that the vaccine probably have a much more robust immune response related to it as opposed to natural infection and the antibodies that result from it. So without going to a lot of biology, I strongly encourage people who may be considering vaccine to get vaccinated because, again, I really would try to avoid getting the COVID disease itself.
I agree, and certainly, of course, I've suffered my own loss because of the virus, but certainly I know many people who have sort of recovered but still carry with them some continued and ongoing ailment. I will tell you this: Dominic Bolella, my high school biology teacher, is thrilled to learn I've actually conquered the basics of biology to keep up with this conversation. So that will be a miracle in his eyes. That said, we actually tonight really great questions. We're going to get to a few more on the phone. Before we do that, I'm going to do two quick ones. I think, Dr. V, and I think I know the answers. Drew is asking, how long do you have to wait to get vaccinated if you already tested positive? The short answer is you don't technically have to wait at all, except we don't want you going to a clinic if you have tested positive until when, Dr. V?
Until you're out of isolation or quarantine.
And no symptoms.
After that, correct.
Yeah.
After that, there is no contraindication on we would not prevent you from getting vaccinated. If you did have a significant or symptomatic case of COVID, some people have opted to wait for about 3 months. But as long as you're not in isolation or quarantine, post-COVID, we will vaccinate you if you come to our pods.
Diane is asking, she's fully vaccinated, but her friend isn't. Is it okay to have lunch with her? What are the risks for each of us? I will answer the first one. It's okay, but what are the risks, Dr. V? She's fully vaccinated. Her friend is not. I would guess that it's best that one of them, when not eating and what have you, keeps a mask on if in close proximity. But go ahead. What's your opinion?
Sure. This sort of ties into what the CDC recent updating guidance talks about. It gives a lot more freedom and latitude for people who are vaccinated. You could probably safely, come together with a small group of family members, as long as it's not from multiple households, and have a get-together, especially if everyone is vaccinated. I think when you get together with individuals who are not vaccinated, the risk is really to the individuals who are not vaccinated with regard to the fact that they may acquire the virus, even though it's a much lower possibility. By the fact that you're vaccinated, your ability to transmit the virus is much lower than someone who is not vaccinated. And so it's probably safe to get together, but because your friend is not vaccinated, I would still, both of you should take precautions in terms of wearing the face covering and the like.
Fair enough, Dr. Wyden. Good time to just reference the CDC guidance, which the county and New York State have embraced regarding masks. If you're fully vaccinated, no need for mask wearing outdoors, excepting if you're in a sort of a large crowded environment. And I will say this on behalf of the county: if you're at a county park and you're at a county you're on the county rail trail, if you're not in a massive crowd and you're vaccinated, there is no expectation that you wear a mask. And I'm just saying that out loud. The expectation is you're outdoors, taking the fresh air, taking the sunlight. Just be respectful that you might be in a crowded scenario. And when you are, not everyone might be vaccinated. Either keep your distance so that you're not, on top of folks we don't necessarily interact with, or slip your mask on, get through the crowd, and move on with your day. But that's basically there's a whole host of other very specific suggestions and guidance from the CDC, but it does basically boil down to that, Dr. V. If you're vaccinated and you're outdoors, no mask is necessary. Just keep certainly cognizant and aware of not being in those large group settings where you're not all in the same boat, right? If you're not all vaccinated, or these are folks you don't know, just be respectful of one another, move on, and enjoy the fresh air. Did I get that right?
Mark, that's an absolutely reasonable, guidance for us to follow, because the data supports it, and everything points to the fact that, especially if you're vaccinated, that getting back to some degree of normal is absolutely reasonable.
Fair enough. The governor today made some additional announcements. I'm not so concerned about the dates as much as you should know what the details are. Meaning, we're moving in this direction over the next 2 weeks. Restaurants and bars, no more curfew after May 17th. For outdoor, at the end of the month for indoor. Our position is basically begin the process. The curfews at bars and restaurants being lifted in the month of May. Capacity limits all increasing in certain facilities. Again, those businesses are aware of what those are, and we're happy to certainly speak to them. But all moving in the right direction. And again, I just want to say, if you're out and about and in an outdoor setting, we now know what the guidance is from the CDC. We absolutely endorse, embrace, and would encourage people, if you're fully vaccinated, take in the fresh air, take in the vitamin D. And to just be cognizant and aware and respectful of others. A couple more we're going to get to. I'm going to do a few telephone questions in just 1 minute. Ed is asking, when will the state allow scouting camps? As we are permitting scout camps in Dutchess. There is no prohibition on overnight camps in Dutchess County by our health department. We're permitting them. They can proceed. And unless the state of New York has issued some specific guidance that we are unaware of, there is no prohibition on those kinds of camping activities. Right, Dr. V, as far as we know? I might know better
Correct.
than you do.
Correct.
Fair enough. We're going to go to, we're going to do this. We're going to go to Gloria B. from Poughkeepsie and then Gloria C. from Dover. Chris, we're going to go to Gloria B. from Poughkeepsie. If you're on the line, you had a question regarding bus service. Gloria?
Yes, good evening. I'm very, very happy for the bus company that sent the bus right to the COVID center in the mall. I'm so proud of the bus company.
Well, they are wonderful people. They work for Dutchess County government, and we are glad to be of some help to you. You got your shot?
You have my 2 from February.
Nice. And the buses are working great. So thank you for those kind words.
Yes, I am so proud. I'm so proud of it. Thank you.
You're welcome. The bus drivers are great. Mike Grattini and the team at the transit department is really great. And, of course, even our Office for the Aging folks all out there being helpful. So thank you for that, Gloria B. We're going to go to Gloria C., who I'm like running a telethon. Gloria C., if you're on the line, regarding homebound vaccinations. Gloria, go ahead.
Yeah, I'm just wondering when the vaccine will be available to the homebound.
It has
My
been.
husband is homebound. He can't be transported.
It is. And you call us tomorrow. You have a pen on you?
I called the Office of the Aged, and is that where you're calling, where you want me to call?
Yes, and they're scheduling them every week. We're doing dozens with the Office for the Aging and Caremount. So when did they tell you that you would have to wait for? What did they give you any direction?
I've been calling for the last 3 weeks, and the last time I called was yesterday.
Well, you call my office tomorrow. I'll give you the number, and I'm going to schedule
Okay.
it, even if I have to do it myself. Homebound is all being scheduled. If you're 60 years of age or older, we're scheduling you, and if you're homebound, you're scheduling. Just so that you should call Office for the Aging. We'll confirm why they gave you that information. But you, Gloria, can call my office at 845. 486 2000, and say that you are Gloria C. Did I get it right?
Yes.
And that we spoke, and we'll get your husband scheduled. Homebound is happening every week.
Thank you so much.
You're welcome.
I appreciate it.
We don't want him to miss a shot. Thanks. Thanks.
Thank you.
You're very welcome.
Bye-bye.
I want to remind you, we're making calls again across Dutchess County. This is County Executive Mark Molinaro. You're on the line with me and Dr. Anil Wythian, Commissioner of Health. We are at number 67 of our town hall meetings. And I really want to thank all of our volunteers. April is volunteer awareness, volunteer recognition month. I want to acknowledge our Medical Reserve Corps volunteers doing tremendous work for months, and really everyone who volunteers throughout this community. We're very, very grateful. And all of our data is now really moving in a very positive way. 600 active cases, 44 hospitalizations, down significantly, 2.3% positivity rate, which is basically a third of what it was 8 weeks ago. And we're very, very grateful for your perseverance, your patience, and how far we've come over these last 18 weeks in that we've been doing vaccinations, 16 months since the onset of the pandemic. We're going to jump to Leonard from East Fishkill. Leonard had a question regarding students in school. If you're there, Leonard, go right ahead.
Yes. Quick question on Dutchess County Community College and whether vaccinations will be required. As we all know, there's been major outbreaks in the colleges and universities. So what's the story there, please?
Well, first, I'll tell you that the numbers in colleges, we've had a few outbreaks. I wouldn't say they were major at a couple of the locations in Dutchess, but generally speaking, very, very good management. I'm not in charge of making that decision, but as far as I know, the colleges are not even Dutchess, are mandating vaccinations. Dr. V, are you aware of any decision to mandate vaccination at the colleges? I think the goal is to get people to choose to be vaccinated, and then if you're not, just to keep safe. Is that what's your understanding, Dr. Wythian?
Within Dutchess, I think what you just mentioned is what the status is. At present there is no mandate, but what I will tell you, in other states and in other colleges, I could speak for my daughter. Before she goes back in the fall, her college has contacted her that to be on campus, vaccination is required. So some institution of higher learning has taken the step of mandating it for their students that they're going to be on campus, but I do not believe that any of that decision making has been done in Dutchess County institutions of higher learning.
And we'll promote that, Leonard, as soon as we know what the Community College Board of Trustees and their administration has decided, but I don't think it's been mandated as of yet. I want to get to a few Facebook questions. Again, you're on the phone you're on the telephone and Facebook Live Town Hall with County Executive Mark Molinaro, Dr. Anil Wythian, our Commissioner of Health. And we're grateful. If you have a question, dial 0 on your phone or write the question in the comment section below the live stream. A lot of great questions today. Ashley, why are some schools back to normal and some are not? Well, New York State allows every school district to make that decision. Now, we've advised our health department, we don't have control or regulation over school districts, but we've been working with them really every week for 18 months now or 16 months now. We have advised the school districts some time ago that strict adherence to the 6-foot distancing was no longer necessary and that greater capacity could be achieved. Schools made the choice to return. Most in our county have returned to at least 4 full days of in-person, but there are still some school districts that, for whatever reason, logistics or otherwise, have chosen not to do that. But New York State permits the district to make those choices. The county has advised districts, however, that there is a much lesser risk among children or young people, I shouldn't say children, students, to transmit the virus in a controlled setting like a school, and therefore, if people are following the basic mitigation steps that we've been discussing all along, we advised some weeks ago that it was entirely safe to increase the capacity, even if that meant, by the way, students being on a bus setting for a period of time with a mask that might be a little bit more congested. But we've made it clear that returning to something that resembles more of a traditional full-time program was was safe and appropriate. But districts were able to make that decision on their own. Annette Marzon asked, what plans does the county have for pop-up vaccination clinics in the city of Poughkeepsie? Well, we're going to continue doing what we've been doing. The Department of Behavioral and Community Health has hosted no less than 2, maybe 3 clinics at our North Road in the city of Poughkeepsie location. Sun River Community Health, which is a federal health clinic, has been hosting pop-up clinics at Family Partnership Center, and these are doses that we provided them. With Dr. Smaller, we have hosted, in fact, just 2 weeks ago, hosted a clinic at the Poughkeepsie High School, principally for Poughkeepsie School District school members. We had a clinic at Maplewood and one of the Maplewood housing facility, and there will be more pop-up clinics and those kinds of smaller clinics in and around the city of Poughkeepsie. A good time to remind folks that we continue to offer appointments at our fixed locations. We've done this at the JCPenney's in Poughkeepsie, former JCPenney's in Poughkeepsie, and the CVS in Dover. We're also now, with the reactivation of the Johnson & Johnson doses moving forward. We had a clinic today at Dutchess Community College. We'll be in Unionvale on May 3rd. We'll be in Beekman on May 5th. And then we're going to be at the Stissing Mountain High School in Pine Plains on May 2nd. We're in Millerton this coming Friday, I think. Does that sound right? Give or take. And we're all around the county. You're going to see more and more. We're going to continue to push it more and more. And most of our fixed locations are taking walk-ins as scheduled. So keep an eye out online. Watch Facebook. Watch for your email. Supply has met demand, and we haven't seen a huge drop-off, but we obviously are at a point now where it is much easier to get an appointment, and we definitely encourage you to make that choice. Megan, where can I get a rapid COVID test? Megan, where can I get a rapid COVID test? Pulse MD in Poughkeepsie, and actually other locations, but in Poughkeepsie, Emergency 1, CVS, and I think we hopefully will have a mobile testing capacity up and around Dutchess County in the next couple of weeks to assist with high school graduations, activities at the stadium, and what have you. I'm going to get to John's question about creative ways to get more people into the pods, but I want to get through as many of these as I possibly can. Jason has 2 questions. Jason is a questioner. When will the DMV fully open back up, asks Tim. That's a decision made by the county clerk and the New York State Department of Motor Vehicles. They are very comfortable moving in that direction, but there still are some logistic issues that the state has to address. That is not up to me, but it is a decision that will be made between the county clerk, independent elected official, and the state of New York. Here you go. Sandy, when will veterinarian offices allow people to go into office with their pets? I honestly don't know. I would say if you're vaccinated, it would probably limit the risk. But the state is really allowing those entities to make those choices. I don't think there's a blanket prohibition at this point, but healthcare providers, even healthcare providers for our pets, are asked to make those decisions that they feel safest for themselves. But Dr. Villa, I don't think there's an outright prohibition on a veterinarian. I think that they've just made that decision individually as part of their safety plans. Does that sound right?
That sounds absolutely right. Individual providers can decide what policies and procedures that they themselves as well as their clients have to adhere to.
Okay, are you ready for this? Dr. V, I have one person, PD Pete, who has 6 questions. I'm going to go through them very quickly. I think you're going to know this. Is it true you need a booster shot 6 months after full vaccination?
Currently, there is no guidance in terms of how long the vaccination lasts.
So the answer is currently it's not true that you need one 6 months from now.
Correct.
How long will you need to continue to get a booster shot? We don't know if you're going to need one, and we don't know how often you might need one, but it is likely, Dr. V, that we would need an annual booster shot. Is that about what we think we're headed toward?
It's probably a strong possibility.
Okay. How long does the vaccine last?
We don't know yet.
We don't know yet.
Still gathering data.
Right.
But we do know that definitely it's 6 months or more.
Right. So based on the data we know, based on the people who were in the testing, and then ultimately the amount of vaccines we've been given, that window continues to move forward. Right. Every day we give a vaccine, the longer someone remains basically immune or protected from the virus, then we know more data. But the window continues to expand, and 6 months was the sort of the minimum expectation. We're learning more as we move forward. Is that about right?
That is correct.
I'm getting good at this.
The 6 month mark was achieved a couple of weeks ago in the report. So the people who are vaccinated, if they're part of a study, they're doing surveys on a repeated basis. So that mark keeps extending out more and more.
Does the vaccine affect women who are breastfeeding? Dr. V, this
should not.
This is beyond me.
The vaccine should not. The only thing is there's not a lot of data because, again, pregnant and lactating females were not represented significantly in the clinical trials that was done. But nonetheless, they are recommended to get the vaccine.
Why, Dr. V, do we say these vaccines are safe, and what do we know about the side effects? Last of his questions.
Okay. With regard to safety, we all know now that, again, with the Johnson & Johnson platform, which is similar to the AstraZeneca because the platform uses an adenovirus, that there is a very small risk. And that risk can be calculated this way, meaning with regard to severe clotting abnormalities or clotting events, there's a possibility of less than 2 cases per million vaccine administered. That is associated with the Johnson & Johnson or the Janssen product. With the Moderna and the Pfizer, again, we are not seeing major or significant adverse outcomes related to those vaccines. That is why we're saying, given the sheer number of vaccines that have been administered and the number of side effects that we are monitoring, that we call these vaccine products safe as well as very effective.
Thank you for that. We're going to go to a few phone call questions in just 1 second. Claire asked if boosters are needed, will the same clinics be open, or will residents have to go to their doctor? The expectation is that there will be wide enough distribution of the vaccine and more general, choice making that you would go to your physician or a pharmacy, similar to a flu shot, and the health departments would likely still have some supply available that we would conduct regular clinics as we do the flu shot. The reason there was this massive mobilization in the way that we've done it, and we did this 100 years ago, right? And by the way, for some other viruses that have come along in the interim, was to move quickly to provide access to as many Americans as possible, as quickly as possible. But as you get into the normal routine of choosing to be vaccinated, it will become more of a traditional distribution. Your doctor's office, your physician, your pharmacy, a health clinic, or the health department. But that's basically what you should expect. So I think let's go to.
Mark,
go ahead.
Go ahead. Quickly interject?
Yeah, please.
So currently, all 3 vaccine platforms are covered under the emergency use authorization. When they become licensed, any provider can order and receive the vaccine. So it will become a lot more routine and widely available when they are licensed.
Terrific. We're going to go to a very sensitive question. Mitchell is going to ask a question. I don't know if it's Mitchell's gone. Well, Mitchell's question, I love this one, Dr. V, so I'm going to ask it on his behalf. Mitchell has been vaccinated. His fiance has not been vaccinated. If she doesn't get vaccinated, what is her risk? And be very careful, Dr. V. This could be either the thing that confirms or ends their presumptive and expected nuptials. Do you want to take a stab at that one, or should we let them make their own decisions?
I will stay away from that as far as I can.
I don't mean to make light, Mitchell. Listen, this is what we know, right, Dr. V? If you're both not vaccinated, higher risk. If one is vaccinated, the other is not, lesser risk. Does Mitchell have a much lesser chance of carrying the virus and giving it to his fiancée because he's vaccinated? Yes, correct. Much lesser chance. However, because she's not vaccinated, she still could contract the virus. My suggestion, however, is that they have some good long conversations about what they want to do next in life, and Mitchell should be very safe because, God forbid, he got his future fiancée sick. We don't want that to happen. How's that? Does that sound pretty good, Anil?
That sounds great.
You don't want to give any future marital counseling? I can't imagine. That is a great question. We've got tonight might be the best of them. This is the best of our questions. We're going to go to I don't know. Is it Gelsomina? Is that right, Miss Frank? How's that?
Yes.
Okay. What's your first name?
Nina, I go by, much easier.
Well, thank you. I wish they told me that. Why don't you go ahead and ask your question? It's a great one.
I just want to know what the county is doing to address the hesitancy. I'm a local pharmacist. We started administering the vaccine just as it was paused. And we still see a lot of people that just don't want it.
Yeah.
So what are we doing as a county to educate them and stop the misinformation that is being propagated both ways? Too many benefits or not enough and too much risk. There's misinformation on all ends of it. So I think...
Well, so number one, one of the very simple things that we do is what you're participating in now. There are 25,000 residents on the call. They get to hear some of the answers to the questions. We do it in a way, and I'm very candid about this. I don't think government is effective when it tells people things that it doesn't necessarily want to hear by people that they don't necessarily trust. I believe that the most effective way to get information to people is to find a trusted source. And Mina, you're one of them as a pharmacist, right? When somebody, and you know this, somebody asks you a question a little bit hesitant, they're asking you because you have a relationship and an educational experience that they trust. Now, some people won't trust you, but they might trust their church leader or their synagogue leader. So our vaccine outreach committee led by John Penny, it's a very diverse group of people. We're continuing to give more and more information in a way that simply acknowledges people's skepticism and meets them there. I think it's very important not to, and you're not suggesting it, not to discredit someone because they believe something that we don't think is right, but rather to explain why we think the data or the information is not entirely accurate, and this is the best way to proceed. And that by encouraging people to make the choice, we're more likely to get more participation. The other is, as people become vaccinated, and they've made those decisions, they too can be ambassadors and communicate. So we're giving people more and more information and just asking them to be open to it. But at the end of the day, it is a choice. It's just going to take us time to get to everybody who may want it, and some are going to change their minds, and some are going to never decide to do it. That's okay, but we're little by little confronting it in a very, I think, informative and non-confrontational way, and I think that's the most helpful way to get people to ultimately make the choice. It's got to be their decision, and I think little by little we're going to get there. But we are already at 56% of the county's eligible population. We suspect that we will get very near that 60% number, and then it's going to be 25 shots here, 15 shots there, until we incrementally get to a point, and I suspect we will, where we're much closer to that 70 and 80%. But that I think is the right approach. And by the way, if you have patients or customers that have a particular set of questions to be answered, we have materials to help. So please do reach back out to us, and we'll try to reinforce it. We need trusted people to give good information. I think that's the most effective way to confront hesitancy. Now, there are other things, right? There's language barriers, so we do a lot of our communication in Spanish and English. There are some faith-based barriers that again, by getting faith leaders to answer questions and to open up the conversation, they are able to confront those as well. and then there will be people who just choose not to, and they're going to go about their lives the way they wish, and we're not going to shame them.
No,
How's that?
not.
Where are your
Perfect.
pharmacy? Now, you don't have to tell me what location are you? What town?
In Poughkeepsie,
Wonderful.
Beekman Pharmacy. But,
You-
yes, but I also volunteered with at a couple of the pods, and incredibly impressed with how many vaccines we could do, and the efficiency and the professionalism. It was incredible.
You all did wonderful work as volunteers at the MRC, but I want to say this to all of our pharmacists and to the pharmacies across the county. You have been truly invaluable these last few months, and in a lot of ways, you are the person that people ask the question to because they can't get their doctor or they don't have one. They're calling and talking to you, and that's been really helpful. So thanks for your role as well.
Thank you.
You're welcome. Have a great day. Mina.
Thank you.
You're welcome. We're going to jump to Pete in Wappingers Falls. Pete in Wappingers Falls has a question about a pool and a workout room. Go ahead, Pete.
Yes, I belong to a community that has a pool, community center, workout room, kitchen, and whatever. And then they said lately that they are waiting for the county, you, to give them permission to open up.
They are permitted to open.
They are permitted to open.
There is no prohibition on community pools or community gyms. There are, however, the state still has certain guidelines. I think gyms, in fact, I just have it in front of me somewhere. Gyms can be at 50% capacity in mid-May. So a gym in a community center can have up to 50%, basically at this point up to 50% capacity. Pools are not at all prohibited. They just have to get their permits through the health department. There's nothing being delayed. However, I will say a lot of the community associations, perhaps like the ones you're living in, I will offer they tend to use the health department as a reason to slow things down, but they may have to make some insurance decisions that they don't feel comfortable making. I'm not saying yours is, but we've confronted that before. There is no prohibition. Yeah, no prohibition from us.
But we are all owners of the pool, the clubhouse, the workout center. We all are owners of everything in here, okay?
Yeah, good.
And it's my understanding that if they say they're afraid of lawsuits, that we cannot sue ourselves.
No, you can. This is America. But that said, I don't know the detail of your association, but I will say to you there is no county health department prohibition, and we are permitting, meaning not we're permitting like it's okay. We're the ones that have to give out the permits, and we are providing those permits for pools. There is no prohibition. We're just asking people to be sensible about the numbers that congregate around the pool at this point. But there's no prohibition on our part. And if you want to have whoever's in charge of that decision reach out to our health department, please have them do. And you can tell them the county executive said to you, there is no county health department prohibition.
Okay, that goes through the clubhouse and the workout center. The workout center is at 50%, but other than that,
a clubhouse is likely limited.
The
clubhouse is likely limited capacity as well, depending on the usage. Like if you're sitting around and what have you, it would probably function like a restaurant, which could be up to 75%, and the gym at 50%. And then the pool, there'd be some consideration for the numbers of people who could congregate around. But again, it's not very strict. It's just we'll educate and provide the permit. Okay.
Okay, thank you very much.
Hey, no problem, Pete. Thanks very much for your question. We're going to get through a handful of Facebook questions. I want to be sensitive to time. I don't even know what time it is, but we've got 10 more minutes. Sue, when can barber shops and hair salons increase the amount of clients in the building at one time? I don't know. I think, so this is one of these things where the state of New York required barber shops and what have you to establish safety plans. I don't know that they're totally prohibiting people from being in the space, but if your safety plan was developed in that way, it remains, and therefore it may not be, it may be up to the barbershop and the hair salon. I don't have a direct answer, but I will have Ron Hicks, who's Assistant County Executive, do a little more research, and if we can't, Sue, if you're watching and you want to reach back to us via email, we'll try to get you an answer, and if we know more, we'll post it online or get you some more info next week. Janine, several doctors say you have to wait 90 days after having COVID to get vaccinated. Please clarify Dr. V's answer. It makes a difference for her daughter's college in-person attendance. I'm going to clarify because I've heard Dr. V say it. Dr. V's position, and at the Dutchess County Health Clinics, once you have completed isolation, quarantine, and are not symptomatic, we will give you a vaccine, correct? Anil?
That is correct.
There is not an outright prohibition. Now, there is some, I remember this, right? There was some chatter about it's best to wait, but that's just mostly because they want to be sure you're not transmitting the virus, correct? It's not because we don't think it's effective. It's because we want to be sure you're totally out of the clear.
That is correct. What I want people to understand, just because you're positive or may have symptomatic COVID, your level of antibodies vary, and you may not have protective antibodies. And so the guidance is there's no contraindication if you had COVID, once you recover, to get vaccinated. If you choose, you can. If you had symptomatic COVID, you can choose to wait 90 days, because if you were sick, really sick with COVID, chances are you develop significant antibodies. But if you just tested positive, there is nothing that says you have significant antibodies that's protective. So I would recommend, if you have a chance to get vaccinated, to get vaccinated.
And so our advice, Dr. Wythian, this is our position. Now, I assume any clinic can decide what they want to do, but our position, the health department's position, is once you're out of isolation and you are not symptomatic and you're basically back to sort of basic activity, you can come in and get your vaccine. And we have plenty of opportunities to do that at any one of the county's health department clinics. So feel free to reach out. Lee, can employers enforce the vaccine? In New York State, employers can mandate vaccination. Yes, an employer can mandate a vaccination under the law in the state of New York. This employer, Dutchess County government, is not mandating. We want people to conclude that on their own and make that choice. But yes, under New York State law, employers can mandate vaccinations. Jason, who's online, I am going to get to his questions. He's got two of them that are pretty detailed. I just want to try to get to a few other, less detailed questions. Nate, is there any help still available for people in need? You know someone who can't pay their electric? Yes, there is. You can visit DutchessNY.gov. You want to look up the Rent and Utility Relief Program. That deadline is May 17th. These are federal dollars that are available for individuals who have challenges with still paying their rent or other utility issues. DutchessNY.gov. Thanks for that. We're going to go to Donna from East Fishkill. If Donna from East Fishkill is there, we have a question regarding copay. Go ahead.
Yeah, I was just curious whether or not, right now the vaccine is free, but the boosters going forward, are they going to be free too?
I highly doubt it. I think that what you're going to see, well, I should put that differently. You're going to see a scenario where it will mirror the flu shot. It will likely be something that is associated with the flu shot. So what your physician or pharmacy does is up to them. Now, I know if you can't pay, the health department does administer those flu shots. So it's going to become a routine thing that you're going to choose to do, like shingle shots and the flu shot. Yeah, but I would expect I would expect it becomes whatever is your normal health insurance if you have it. In some cases, they don't charge you. I'm sorry.
I just wanted to ask the doctor too. I'm allergic to the flu shot because I break out my arms. And, so many years I went through it all, and I realized it was, the flu shot. And I was wondering, is there any kind of complications with the vaccine now that causes side effects like that for the skin?
Dr. V?
There can be local reaction with any of the vaccines. And so it's not related to just the flu shot. Any vaccine can cause local reactions, including rash.
So
yeah, because mine would last from when I got the vaccine, the flu shot, right on through to March when it kind of wears off, and then all summer I'd be fine, and then I would get the flu shot again, and my arms would break out and itch. Yeah, so I haven't had the vaccine yet, and I'm just leery of getting it for that reason.
So
if you've had significant reaction, this is something that you should be in discussion with your physician in terms of what is most appropriate.
And that's the best advice we got. Hey, thank you very much for your question. John is asking
Thank
any
you.
creative ideas, plans to get more people to the pods to go and get vaccine. We're going to continue to do outreach, John, and communicate as best we can. I mean, our policy has been to continue to educate, continue to provide quality information, to respond to skepticism, and to empower trusted sources. This is I feel like it's a term that isn't as common, but you trust somebody in your life. We want that person and those people to be the ones you turn to and to get information from. And so again, I said this early on in the pandemic. People don't respond well to being told to do something by people they don't trust. And so by empowering people you do trust, the pharmacy, the doctor, your faith leader, to simply answer the question, provide information in an effective way, we're going to get people to make that choice, and we want them to make that choice themselves. That is the most important thing. If you get the J&J vaccine, how long do you have to watch for blood clots? Dr. V, this is from Nate. First, to be clear, the advice from the FDA is if you are a female 50 years of age and younger, you should be aware of the potential for blood clotting. Is that correct, or is it male and female?
That is correct, but there are cases now reported in males also.
And so the expectation is that you should wait, you should monitor your condition for about 3 weeks. Is that correct?
Typically, that is correct, because actually all of the cases were discovered before the three-week mark.
And so the other is, right, it's not that the clot, so there's the concern regarding the blood clotting, but because there may be blood clotting, it's the treatment of that blood clotting you want to be aware of, right? And the physicians need to be aware of that. Is that correct as well?
Yeah, the treatment also would be different, but I would like to make an analogy. In terms of the vaccine, the expected complications of a clot with the Johnson & Johnson vaccine is less than 2 occurrences for every million doses administered. But for every million cases of active COVID, there are probably more than 150 cases of clotting related to COVID disease itself. So in terms of magnitudes, they're quite different. It's much better to get the vaccine and have immunity than to get the disease itself.
Thank you for that. I'm going to ask Rebecca's question from Hopewell. I'm going to, just for sake of timing, I know, Rebecca, if you're listening, your question is the new 988 suicide hotline number up and running? The short answer is not yet. That national number will become available in 2022. However, 24 hours a day, 7 days a week in Dutchess County, the suicide hotline is our helpline. If you have a mental health concern, if there is a question of that needs to be addressed by mental health professionals in Dutchess County, 24 hours a day, 7 days a week, it's 845-485-9700. We're one of the oldest helplines in America, 845-485-9700. The 988 suicide hotline national number will be available in 2022. Dr. V, you ready? Jason, is it true the vaccine has dedicated blockers to block only COVID, and because they're so strong, the vaccine could allow other viruses to get through? I don't know that. I think what he's basically saying is that because
that's a complex question.
Yeah.
So the vaccine, depending on what the platform is, it causes your body to make antibodies that's very specific to targets that's on the COVID virus itself or the SARS-CoV-2 virus itself. Now, that doesn't protect you against the common flu or an adenovirus or all the other range of viruses that are out there. So, yes, it's protective and very unique targets against the SARS-CoV virus, but not other viruses.
But it doesn't make you more susceptible, or does it make you more susceptible to other viruses?
There's nothing in the literature that states that it does.
So I don't want to at all dismiss the question. I think every question has validity, but that would be like making the argument. I mean, right? It would be like saying, well, I took the flu shot and it's not protecting me from shingles, right? I mean, they're different things. Is that? I mean, no, right? I
will tell you that there are many vaccines. take that back. There are many diseases, including viral diseases, that reduces your immunity, meaning it affects your T cell response and can put you at risk for other infections. But vaccines are not known to do that.
Thank you for that. Second question. The vaccine works with your DNA. Is there a way we could know the results of how the vaccines affect future generations' health? And I know that this is actually a legitimate concern that people have. First of all, this concept of messenger RNA is a bit foreign, although we've been studying it for over nearly 30 years now, I think 20 years now. But that said, because of the use of the messenger RNA, is there a belief that this might have long-term generational effect? And the short answer, of course, is we don't know everything. But go ahead.
The answer actually is absolutely no.
Thank you.
Messenger RNA and DNA are separate. So what the mRNAs do is it's a code, and it does not get into your nucleus. It does not connect or intercalate itself into your DNA. What it does, it goes into your cell, the cell's mechanism or ribosome reads that code. As soon as that code is read and protein is made, that code is destroyed. It doesn't sit around your cell. It doesn't last long. It doesn't inject itself into your DNA. So your concerns for long-term genetic side effects should be unfounded. That's not how this biology works.
Thank you for that. And what I meant was I mean, not the DNA component, but the fact of the matter is, we're learning as we learn, right? So we know as much as we know about the vaccines, but they are imperfect, and so over time we'll know more.
Correct.
Yeah, but yes, I understand.
That is absolutely correct. We'll learn in terms of long-term issues with the vaccine the more we have experience with it. But in terms of the code itself, the way that mRNA vaccines work, the code is read, a protein is formed, and the code is destroyed.
Thank you for that. And nothing like destroying a good code. With that, we're nearing the end. Marie is on the phone. Marie, I want you to call my office. We'll try to get you a direct answer. Your son is at Hedgewood. I know that there is some lifting of some of the visitation and connection, and I don't have that answer readily available to you, but I want you to call our office. So, Marie, if you're listening, 845-486-2000, 845-486-2000. We'll try to get a specific answer as to what the Hedgewood rules and guidance has been and try to help you. Beth asked about masks being voluntary. What I would tell you is, and Dr. V, right, we know we're moving in that direction, right? I think Massachusetts announced today that they expect most of their guidance, even mask wearing, to come to an end in August. I think that we have gone through the tunnel. We are in the light, and you are going to see a precipitous decline, we trust, with vaccinations and folks making those smart choices, a decline in these guidances. And frankly, we saw some of that happen today in New York. There needs to be more. I mean, I've advocated for more. We're all advocating for doing what's safe. But I think we're moving in that direction, Dr. V.
Yes, we are moving in that direction.
And so,
absolutely.
And so we'll continue to advocate for that as well as we make these safe choices moving forward. So with that, I want to thank you for being on the call. This is County Executive Mark Molinaro. You were joined this evening by Dr. Anil Waithian, our Commissioner of Health. Anil, I really thank you. This was a very spirited town hall, and you held up pretty well. And for number 67, you've been doing fine. So we appreciate that. I want to thank you all for joining us this evening. We're going to be live next week on Facebook. We're going to be Mark. This is the Summer Town Hall Series. Mark at the Park. Actually, it should be Marks at Parks. No. Mark at the Parks. We're going to be visiting Dutchess County Parks. We're starting and having our town hall meetings live from there. I think at some point we're going to start inviting people to join us. We'll do it in larger, spaces, but we'll get that organized as well, so we can have some personal interaction safely outdoors. And so our next town hall will be scheduled. There is scheduled for Wednesday, May the 5th at 3 p.m. On Facebook. Thanks for joining our telephone town hall this evening. And as always, please reach out to us at duchessny.gov. happy to try to get you some additional information. In the meantime, stay safe, be healthy, and be kind to each other.